As parents, we hope our children will move through life with as much joy and happiness as possible. But this isn't always the case. Our kids live in a complex world and face serious threats to their emotional and physical well-being. Surprisingly, suicide is the second leading cause of death in youth aged 10 to 19. And as awful as this statistic is, it's preventable. It's important for parents, friends, teachers, and caregivers to learn the signs that your child or teen is thinking about suicide. These might be different than what you expect, or how the media portrays someone who is suicidal that often don't really fit your situation. But suicidal ideation can occur in anyone, and the numbers show that children and teens are a high-risk group. There are certain risk factors that might increase the chance that your child or teen might be thinking about suicide. Be sure to pay attention to these. Is there a history of family suicide or mental health conditions? Has there been childhood abuse, neglect, or trauma? Previous suicide attempts? Being bullied? Struggling with a mental health condition or substance abuse? Or access to firearms, medications, or other means of suicide? If you're worried about your child, here are some signs to look out for. Are there changes in their eating or sleeping patterns? Social isolation from family or friends? Mood swings? Reckless behavior? Giving away belongings? Talking about being a burden or feeling like they just don't belong, or maybe feeling trapped or hopeless? A dramatic drop in grades or school performance? Talking about suicide or death in general? Writing or drawing about suicide or acting it out? Or maybe they show other signs of major depression, low mood for a couple of weeks, or a loss of interest in things they used to love. Maybe they're showing feelings of unworthiness or unable or unwilling to perform daily tasks. Anytime you think someone is thinking about suicide, you should take it seriously. Teach your child that suicidal thoughts should never be a secret, and they should tell a trusted adult. This could save their life or the life of someone else. If you think your child is considering suicide, it can be terrifying, but you can help. If you notice any of these signs, talk to your child. This may feel like a very uncomfortable topic, but here are a few tips to remember. First, talk to them privately. You want them to feel comfortable being honest with you. And really listen. Listen actively and keep an open mind. Avoid talking about the value of life or religious beliefs. At this moment, they just need someone to listen and understand. Don't minimize their problems by comparing them to the problems of others, or don't offer advice. Let them know that you care about them. Many parents feel that asking about suicidal thoughts might make things worse, but the truth is that your child will feel loved and wanted, and it will help. Ask directly if they're thinking about suicide, and then get them the help they need. That might be immediate help if a suicide attempt is imminent, or maybe a more long-term plan, like making an appointment to start counseling sessions and pursuing treatment for depression. If a suicide threat is very real, stay with your child and remove any potential lethal items in the area. You can call for immediate help by dialing 988, or if you're in the coastal Tidewater region of Virginia, call 757-656-7755. Mental health is not a crime, so don't be afraid to get the help you need.